Hello, everyone. Today we are going to be talking about National Rural Health Day. And today we are actually joined by three special guests. All of them are doctors at ThedaCare in Waupaca. We are so lucky to be able to have a hospital in Waupaca. So everyone, please welcome doctors from ThedaCare in Waupaca, Dr. Happ, Dr. Pucillo, and Dr. Lyon.
Hi, everyone.
Yeah, welcome.
Having us.
Thanks for having us.
How long have you all been practicing in Waupaca?
I've been here the longest. I've been here since 2008, so going on 14, actually over 14 years now.
Okay.
I've been here exactly 9 years in November.
Oh, like
In
that.
fact, November 13th will be my 9-year anniversary.
Oh, cool.
And I've been here just over 2 years. I started working in Waupaca in September of 2020, when nothing at all was going on in the world of healthcare.
Thursday, there's National Rural Health Day, and I'm going to let you guys explain it because we are not the experts at all when it comes to health. So can you tell us about National Rural Health Day and why it matters in our community in the Waupaca area especially?
So I think it's good to highlight this in our community because we live in this environment, and in our area, it is the family practice physicians and a few general surgeons are primarily the ones that care for all of the members in our community. And these are, members ranging from people just being born to people at the very end of their life. And so we have a very broad spectrum of people that we care for. And that even includes local nursing homes and the Wisconsin Veterans Home, which has a large population of people that we care for as well. And so because we have all this broad spectrum, this is a unique type situation that very often you only find in rural communities. And with the addition of obstetrics that many of us do, that is that extra kind of, I guess you can say, gem that we offer to the community to have people be able to keep their care locally. You hear a lot of rural health outcomes aren't as good, but what I want to highlight here is that our outcomes that we can offer people are as good or better than outcomes we're seeing in other parts of the country. And I think that's because, we have a good system where we really have a great understanding of the whole family dynamic. And that could be ranging from, a kid we just delivered, then we take care of the mom in pregnancy, we know the grandparents, maybe we know the great grandparents. And so that gives us that huge kind of network to really kind of care for that whole family.
I wanted to echo something that Dr. Happ said just about the breadth of our practice. There will be days when I might spend the morning out at the Wisconsin Veterans Home taking care of veterans, in their 60s, 70s, 80s, 90s, approaching the end of life. And then I might get called into the hospital to round on a baby who had been born 6 hours previously. And there's nothing quite else like that scope, that breadth of practice. It's not necessarily easy at times. And one of the things that we do, both doctors and the excellent nurses that we have in the hospital and the clinic, is we have to keep our skills up in so many different areas at the same time. I just came from a class in Nina about how do we take care of babies who are struggling in those first couple hours of life. We have the expertise to be able to stabilize infants if things go wrong and get them over to a NICU. And we do that because we're continually working as a team to improve the care that we provide. We might only see a baby who's really needing some specialty medical care a couple times a year, but we all practice and drill to keep those skills up so that if that happens in our community, we're providing the top quality care.
Well, yeah, I think people shouldn't take it for granted that we have a facility like this here. My sister's in the medical profession in Montana. She started out as a radiation therapist and was working, I think it's called Malta, Montana. Very, very rural. And, they have a facility there, but it's almost like the equivalent of a non-mobile MASH unit. They have like one bed. Other than that, because it's surrounded by Indian reservation and ranches. So the type of things they encounter are pretty much just prepping them to get on a helicopter and send them somewhere they can get proper help. So I think the people of Waupaca should be grateful for what we have here.
Pretty amazing in a small community to have a 25-bed hospital with a 8 to 10 bed emergency room and ability to do obstetrical care, as well as a full complement of a clinic with a number of, how many physicians, 10, 11 physicians and 6 to 8 nurse practitioners that, can see you for acute care and for chronic care and really try to keep as much of those needs local.
This episode is presented by Northern Kitchen. Northern Kitchen is a brand new store that is in Lucky Tree's family of stores on Main Street in downtown Waupaca. This new kitchen store is on the corner in the last block on North Main Street. It looks fantastic in there. You have to see it to believe it. My mom, Michelle Drake, has been working really hard on this store. It looks great in there. There are lots of great kitchen gadgets that you cannot find anywhere else in the area. Make sure to shop at Northern Kitchen on Main Street in Waupaca.
What do you see like differences treating rural compared to, say, if you're like in a Chicago or something like that, a bigger city, maybe in Appleton? What are the little differences?
I'd say they're big differences, actually.
Are they? Okay.
Mhm.
As family physicians, we are trained in all different areas of medicine. So we do a lot of work with patients with high blood pressure and diabetes and more urban areas. There are specialists for those, and specialists absolutely have a place, and endocrinologists and cardiologists are invaluable. When I was in training, the family doctor that I worked with always explained it as, so like a cardiologist, there's their column. So they learn, and as they learn more, they learn all of this. And then an endocrinologist starts in training and then they learn all of this. And that's how, and family doctors, we start and we learn all of this and then it goes down.
You're basically, you three are a jack of all trades.
To some
Yeah.
degree, and so I think that we offer that ability to take care of a lot of patients' conditions here with one person who knows their story and knows and knows how they all interact with each other and can keep them locally, because we don't have all those. We have some specialists that come out here, but maybe they come out here once a month or a couple times a month. They're not here necessarily all of the time. And we also know when we need extra help, and we know who to reach out to, and we have the support of those specialists in the Appleton area at the bigger hospitals, that when something is above, if we need more help, we can get that, and we can get patients, and we can help the patient to navigate from us to that specialist and make sure that, again, we're looking at a big picture. Sometimes I do have patients who see lots of specialists, but I'm sort of that overseer, the captain of the ship, kind of, where you're watching all these pieces and you're trying to put those together. And sometimes you're helping patients to navigate between them in things that can get really complicated.
It's a fair assessment to say you're pretty much a true first line of defense.
Pretty much.
Mhm.
Yeah, I mean, just example, we had someone, a healthy person, come in last week, very common complaint, fatigue, but it ended up being something very, very serious. And so specialty care beyond even our region was needed. And so we were able to, I may not be a specialist in this area that they needed help, but I was able to coordinate by calling down to the freighter area and coordinate with the specialist so that the person could get in the next day. And so we know our limitations, but we're able to kind of assess the situation and help kind of direct a patient if they need to see a specialist to the right place.
And then the other thing that's special, and this is true, I think, across family medicine, but I think especially in a rural area, is, we build these long-term relationships with our patients. So, I have patients who I take care of them, I take care of their kids, I've taken care of their grandmother. And so sometimes often that relationship building is what helps us, what allows people to open up to us about things going on in their lives, which they wouldn't share to someone else outside of that exam room, to talk about, their mood or their problems with substance use or their anxieties about a pregnancy. We've been talking about obstetrics because we're not anonymous. We take confidentiality really seriously. Even if I'm taking care of a couple, I'm not going to tell the things that the husband tells me to the wife. But those relationships, I think our patients have a level of trust in us that would not be possible. And so I think about this a fair bit with my patients with chronic diseases. And, we prescribe lots of medication. That's what doctors do, right? And medications don't really work if you don't take them. But we know that we're not very good at taking medication. Some of us are excellent. Some of us are pretty lousy at it. I really feel good when my patients tell me, hey, I'm not really taking that medication you asked me to take, because it means that we've gotten to that point in our relationship where they're willing to be honest with me about what's actually going on. And yeah, that might not mean that they're getting the best medical care, but at least they're telling me the truth. So we can start from that point where we're both actually talking about a person as they actually are, not how we kind of want them to be, not how they've kind of dressed up to be in the doctor's office. That's the goal. The goal is to build a relationship where we're actually dealing with each other as people, and then can meet people wherever they're at, and all that, messiness that we all have in our lives.
You hit it right on the head. I mean, that's kind of what this show is all about. And I preach this all the time. If I would have known about Waupaca, as soon as I graduated high school, I would have come straight here. I like Waupaca. And you're right with the relationship part. I've been here, I don't know, 19, 20 years now, something like that. And it's nice, you see your doctor down the street, you become friends with people.
Mhm.
You go in the bank, they know you by your first name. When I've lived in bigger cities, there's always someone new there. You don't build those relationships as much.
Right. Well, speaking of that, along the obstetrics line, I think that's one thing that's extremely unique is that as a family practice doctor, we're committed to caring for our obstetric patients during their prenatal care. And then for most of the time, bar some small reasons why we may not be able to be there, we commit to being with that patient during their labor and delivery process. And then we continue caring for them after they're discharged from the hospital, and we continue caring for their baby. And so that is, for me, my favorite part of my job. It's the most meaningful part, is because that's how you're really building that family relationship. And you begin then caring for each of their kids that you deliver, and you really grow, with your experience with them. So then the next time they're pregnant, you kind of already know, you have this great relationship with each other. And then it's just kind of expected that you would continue caring for them and take care of their next kid. It just kind of adds to itself. It's really that to me is my most rewarding part of my job.
Absolutely. I've been here 14 years, and I realized I was trying to do the math, but I've delivered somewhere between 250 and 300 kids
Mhm.
in my career here,
wow.
which are now 12, 13 years old. I think a great service for patients. They get to know us. We commit to delivering them. So I know that there's groups where you see whoever's on call, and that's just who delivers you, and you see a bunch of people in the clinic, and that's a model that works in a lot of places. And that's, but we're very committed to having that relationship model where I am your doctor. I will see you for your visits. I will be there for your delivery. Again, barring a random vacation or illness or something, but by and large, although, I don't know the percentage of those 300 I've missed, but it's not high.
I know we were both saying when kids were coming by trick-or-treating at our house, you're like, oh, look at all these kids we delivered. It's super fun.
Yeah, it's very rewarding for us too. And to be part of a community where I wear all these hats and get recognized in different ways. So my kids are almost both in high school now and have been through in the Waupaca district their whole school experience, and just fun to go. And sometimes and you watch a choir concert and you're like, oh, I delivered you and you and you and you. And
Did any of you all join in the downtown Halloween?
oh yeah,
That was nuts. Yeah,
that was amazing. Yep, that was a
we
really
handed
amazing.
out like 1,000 pieces of candy or something in like what, Joe, 45 minutes or something.
Yeah.
Yeah, Halloween is a fun night here.
Just you look at something like that and you truly think community.
Mhm.
Yep.
It was pretty
Yep.
cool.
It's fun to run into kids at Halloween, and sometimes I'm doctor and sometimes I'm my kid's mom and sometimes
Mhm.
I'm soccer coach. You know, I have lots of hats and I answer to all of those hats and they all
Mhm.
make me smile.
I know as you stay a place long enough, especially the size of Waupaca, you end up with your fingers in a lot of different pies, it seems like.
Mhm.
Where are you all originally from, Wisconsin?
So I'm not, I'm the Illinoisan in the group. I'm from a town of 30,000 in Western Illinois.
Okay,
Moved
Mhm.
up here, been here over 10 years now.
okay.
I'm from Illinois as well. I always wanted to live in Wisconsin when I was growing up, because that's where my dad's family's from. And I thought, when I grow up, I'm gonna live in Wisconsin someday.
I'm from Madison, but I do have ties to the area. My grandparents bought a cabin on the chain back in the 70s. So I was a summer kid for a long time. And then did my training down in Madison and Baraboo and ended up finding a position here, and it was perfect.
I do have some more questions about ThedaCare, but before that, is there anything else that you want to mention about National Rural Health Day?
I think it's a great time to think about the state of rural health across the country and in our region. We had 2 rural hospitals closed in Wisconsin this year. And we have rural hospitals across the country that are either closing or closing their obstetric units. And, we have no intention of doing either. We're going to be here serving this community because it is. Okay, a confession here that I live in Amherst. So unlike these Waupacans, sorry, you can cut that out.
No, it's still rural though.
Oh, yeah.
yeah.
And back to what you were saying, why did those hospitals close? I mean, was it budget cuts of some sort, or?
Part of it's budget cuts, and part of it is, we're never going to be a high volume center, say on obstetrics, right? We need to be prepared 24/7 to have someone come in the door in labor or come in the door and needing a C-section. And so we have the nurses and physicians and anesthesiologists or nurse anesthetists ready 24/7 to meet that eventuality, because it happens. We might go a couple days when there aren't any moms or babies in the hospital, and then we might get 3 people come in all in the span of a couple hours. And that takes staff and that takes time and that takes space. And ultimately it takes money too. But we know that people do not do as well if they have to drive farther, especially in an emergency. And so rural health is so important, because if an emergency comes up, you want the hospital to be at exit 2 and not exit 60.
I mean, I think that's really important, is that part of the issue is that there's less and less family physicians doing obstetrics. And it's really multifactorial why that's happening. But the challenge is that if that is replaced, for example, with an obstetrician gynecologist, it's hard in a rural setting to be able to support a specialist, which is why they're not often in rural settings. They A, don't have the volume, and B, they don't have their peer support, so that they are stuck then in a situation where they're the only one and potentially on call 24/7, which is not fair to do to them. And so they tend to then have support and stay in the larger communities, which is why, in general, these type of things are moving to kind of be set up in bigger communities in that manner. but then that leaves what's called a maternity desert in rural areas. And so our kind of goal tonight was to highlight how important it is that, we're lucky that we have each other as partners, that, where we support each other. And we have a system set up here in Waupaca and several other ThedaCare rural communities around where we do have that program in place. And our goal is to continue maintaining it. But as Dr. Lyon mentioned, there is definite challenges to maintaining it as well.
We are very fortunate in Waupaca to have such a robust group and doctors who are so well trained in all these different areas. I think some of these rural areas, it's hard to recruit physicians to live there because some people want it for professional reasons, for personal reasons, gravitate to bigger cities. And then that care gets lost in those rural areas where it's really needed.
Do you find in the medical profession that you're having trouble finding staff, just kind of like everyone else is?
Staffing is an issue everywhere across the country. I
Yeah.
don't think it matters if you're rural or urban right now. It's just, it is what it is. But right now, I think we do have an excellent complement of nurses and clinic staff and physicians, and that have been very consistent, that
Mhm.
allows us to continue to offer really high quality care.
Mhm.
So many of our staff come from the community. They want to work here. Well, it's a good place to work, but also because they live here. They see their friends, they help their friends through their difficult times. Just in the last year, we hired a physician who grew up here in Waupaca and a pharmacist, an ambulatory pharmacist, so a pharmacist who sees patients in our clinic who grew up here in Waupaca. So it's pretty amazing the local connections that people have.
I think it's no secret that the city of Waupaca is working on having some new housing, which would then have more people in Waupaca. It would increase our population. This year, even without that, our population has gone up a lot. As far as you know, has ThedaCare looked into this in Waupaca, as far as maybe hiring more physicians to be in our area, since there are a lot more people in Waupaca County and in the city of Waupaca in general?
So in the last 3 years, and I'm one of these, we brought on 6 new doctors. And we're always looking for people. And our commitment is to keep the clinic staffed to the point where we meet the needs of the community.
Well, I mentioned I was in there very recently, and I always look at the wall of doctors. And I can't remember if there was 1 or 2 there that said coming soon. So
Yep, we had a new doctor, Dr. Trevor Argall, started with us just 2 months ago.
Mhm.
And then Dr. Angie Amos is going to be starting with us fall of 2023.
We also need not just physicians, but the full complement of staff. And so, we're always looking to have people come in from, imaging and lab and nursing and medical assistants. So we do need everyone in order to run the right way that we need to take care of people.
yeah, like I said, it kind of troubled me when Dr. Lyon mentioned a couple of other rural units had closed. I'm assuming it was because of funding or maybe staffing, whatever. What can be done to bring some of that back or maintain it? Is it just a matter of money?
This is a tough one. I mean, healthcare in general is not what it used to be. Hospitals are not out there making lots of money.
Yeah.
And as the payment system changes each year, it seems to become harder and harder. And that's something that I personally can't speak to in the details because that's not our focus. But I know that that's a challenge for, big hospitals and little hospitals. In specifically the little hospitals, for example, if specifically speaking of obstetrics, like Dr. Lyon had mentioned, if you're not doing these deliveries on a very regular basis, it becomes very expensive to staff for that. not just the physicians, but to have all of the equipment and all of the people needed to keep patients safe and to have these good deliveries that we're talking about. And so it kind of is like there's a critical mass that's needed of patients and staff and providers. And so if you get below that critical mass, then you start running into problems on either side.
Yeah, one way to think is we're here for the community. We want to support the health of the community. We also need the community to need us. Hopefully people in our community are coming to us as their primary care physician and are coming to us for their deliveries and are having their procedures done in our hospital and utilizing our services. That is what we want. That is what we are here for. And that is what helps continue to grow and keep us and maintain all the services we're offering, is making sure that they continue to be used. There's a lot of really creative things going on with staffing, and the high school has had a certified nurse assistant program training process that they offer through Fox Valley. I know that they're looking at trying to partner with maybe Fox Valley Tech as far as training for MAs and medical assistants, and even right out of high school, and just ways to introduce, and I know the high school has a health occupations class to introduce students even as young as sophomores and juniors into these healthcare roles and options and positions that then we could support their training for, and then they could continue to work in the community.
Do you find that the community of Waupaca, as being rural and everything, do you find they've got your back?
I was talking to one of my patients who's in her 70s about, what she does for exercise. And she, told me all about the senior center and all the great programs there. And a couple weeks later, I'm looking in my mailbox in clinic, and here's this packet of 40 brochures from the senior center for me to give out to my other patients. So she's in her office seeing me about her health, and her first thought is, how can I help 40 other people?
I think that kind of speaks to the whole relationship part of it too, because she trusted you, and she knows that, you are invested in the community, and then you're going to then disperse information, because that's what we do. We share information with each other, and, then suddenly I'll have some of those flyers in my inbox, and I'll say, hey, to another patient, here's this great program.
If I am someone that is either in the area and not going to ThedaCare, or just needs a new primary doctor, what should I do?
Give us a call. Let us know what you need, and we will help to make it happen.
Are there certain doctors that help in certain health situations compared to others at ThedaCare?
In our clinic as family doctors, we pretty much almost all have the same skill set, other than obstetrics. I said 80% of us do obstetrics, and the two that don't can certainly
I
do
would
everything
say
else.
yes, but plus Dr. Lyon, I think you should speak to this part of it, because I think there is a specific group of providers who really help focus on patients who are struggling with addiction too.
That's true.
The work that about half of us are doing to help patients with substance use disorders in our area, because we know with the overdose epidemic, the main cause of premature death in young people in our country right now is overdose from opioids and methamphetamine. And we have really good treatments, medications that can help prevent overdoses and help people treat their opioid use disorder in particular. So we're up to, I believe, 7 of the doctors and 1 of the physician's assistants who prescribe the medication buprenorphine, which is one of the best medications to help treat opioid use disorder and help people get their lives back on track when they're struggling with the substance use disorder. And it's really been rewarding work. And I'm so blessed to have so many colleagues who have just joined in to help. We went from treating about 3 patients 2 years ago to probably treating 70 these days. The other thing I think about with that work is so many people who are struggling with the substance, well, so many just young people in general, but especially people struggling with mental health or with substance use disorder have lost confidence that we can help them. And it's so great to have people come in and rebuild that confidence that, look, we can help you put your life back together. We can be a really important part of that.
Has the mental health crisis dramatically increased in our area?
You know, the pandemic has been hard for lots of people. And so it's made depression and anxiety a lot more common. You know, they're really common conditions in the best of times. It's made substance use, alcohol use, opioid use much more common too. One of the great things about our clinic in Waupaca is we don't shut the door to anyone. You know, if you don't have insurance, we have patient assistance programs where you shouldn't need to pay for the care that you get from our group. We have a pharmacy that will write in the building, which the same thing is true for medications. So our goal is to be there for everyone. And if people are encountering barriers to that, they should let us know.
Mhm. Sometimes we don't see the barriers, so it's good to hear that feedback.
It really is. And as the physicians, we're committed to making the clinic open for everyone.
We are all, every single one of the physicians has open practices. We are all open to new patients. We have urgent care, same day appointments available. If you are traveling through town and you've got strep throat, and come here, we'll take care of you.
And then if you have an urgency, like we've been talking a lot about obstetrics, but if you find out that you're pregnant and you really want to talk to someone about what does this mean for my life, this big change, and who's going to help me through this pregnancy, we'll see you within the next day or so. So
Committed to opening spots every day for urgent obstetrical issues. So one of us is here if anybody needs us.
In our rural location, we're lucky to have a full building that's getting fully renovated just to focus on local mental health and substance use disorders. So we'll have a full complement of people available to help us so that we can refer patients to them, and they will work in closer coordination with them. They'll be just across the parking lot.
Does that include the possibility of more therapists in our area?
Yeah.
Because that's a really big need right now.
You're right.
Absolutely.
And in that new building, we're also going to have space to do group therapy as well. So my real hope is that, part of what we can do in that new space is bring people together.
It's nice that when you're having some issues or troubles, all of a sudden you run into other people who are having the same issues or troubles. It kind of, you don't feel, I guess, strange or weird as much then, or like, what's wrong with me? I need to go hide under a rock or whatever. More people need to know about this, because I personally didn't realize, beyond just, the well checks and so forth, the broad scope of things you all cover.
It's amazing because, we're all people. We all have our myriad of health problems. So I might be talking about someone's depression as I'm, trimming a planter's board off their foot, or they might be seeing me for substance use disorder and then get pregnant, and I'm taking care of them during their pregnancy. We can address a lot, and it can often address a lot in what could be, 4 different appointments in a different practice.
Like I said, this is the first time I'm surprised at the scope of things. I just didn't know. If I don't know, how many others don't?
I appreciate you listening to us, because I feel like this is a common thing, and that's why we wanted to really kind of put it out there, because I'm not sure how well we advertise for ourselves, and it's not like I'm trying to do that. I just we all wanted to explain what we do.
You just wanted to help.
Yeah. Just real quick here before we end, when is that new building for mental health that's being renovated? When's that going to be done?
It's a great question.
They actually believe by the fall of 2023, I believe.
Okay, and that is across the parking lot? Where is this?
Old River Hill Dental.
Okay.
So, and right next door.
Mhm.
So we do currently have therapists and we have psychiatrists that are coming over to the 900. So we have services in town. but they're a little scattered and spread out. So this new building will bring everyone together, but rest assured, we do have those services locally in the interim. We're just really looking forward to getting them all together and being able to expand.
And have a nice new facility. for
And a
that.
new facility for them, absolutely. And then just looking at other services and just some other shout outs, just some amazing work. When we talk about chronic disease, we have a group of the best diabetic educators I've ever worked with in my career that
They're
are here.
amazing.
They're incredible.
I couldn't
They
do my job
will-
without them.
No, they will go to bed if there's trouble, if you can't afford your medication, if you're struggling, they are there for you. They do in-person group exercise programs to teach anything and everything you'd want to know. And even cooler this year, as ThedaCare has started a diabetes prevention program that is a free program to our community. It is by Zoom. I believe it's a year-long, I think it's monthly Zoom meetings, because they're offering it to a big geographic area. But education, exercise ideas, meal ideas, again, yes, we can take care of your chronic disease, but we would way rather you never had it to begin with.
Good point.
And
Yep,
that is
that's
our goal.
is upstream management.
Absolutely. Our goal is prevention. Our goal is get you the tools that you don't see these chronic disease. I don't tell people I never want to diagnose diabetes, and I want to be able to prevent that. Just like we don't want to diagnose cancer. We have for colonoscopies now recommended 45 to 50. We have a family doctor and we have surgeons that come out here most days a week to do those in our hospital. We have 2 surgeon groups that are covering for, so we didn't talk about surgical services, but we have 2 groups from the Valley that come out here, see clinic patients, can do procedures in our hospital. Our orthopedic clinic is growing with some new faces that are committed to offering some more services out here. So I think those are really exciting things happening.
Mhm.
Thank you so much for being on PodPaca and telling us about National Rural Health Day. And make sure to check out ThedaCare in Waupaca if you are in the local area. Other than Waupaca, real quick, what other small towns usually depend on ThedaCare Waupaca for your services compared to a different hospital?
So we have and in our area, so we are the only hospital in the county and the only place with a obstetrical unit in the county. But we do have clinics in Iola, Wild Rose, Waupaca, and then ThedaCare does have a hospital in New London, and clinics in New London as well as some surrounding areas, Clintonville, Tigerton. I get lost again with the county lines a little bit, but try to have a lot of outreach. Vail Manawa has a clinic. So
I think we draw from a pretty wide area though. I mean, if we actually have a pretty big draw, just because we do offer a fair amount of services. And so we have people driving from, up to an hour away, Marion, Plainfield, all over that
even
area.
down to Westfield.
Westfield, yep.
Getting down, because you get down to Watoma, which also has a ThedaCare clinic. Wild Rose does have a small hospital, but you get into Adams Friendship and there's.
I mean, yeah,
and
I would
in
say,
other
I mean,
parts
all
of-
the way out to Stevens Point, definitely the Amherst area and Custer, all that.
Kind of you mentioned the ThedaCare is expanding a bit. Is there room on that campus for even more expansion, 10, 15, 20 years from now? I'm sure they got a long range plan. Most people do.
Yeah, I mean, the idea would be in the future to potentially upgrade the birthing unit and modernize it, as well as the ER and the operating suite probably too.
Okay. 'Cause it wasn't that long ago, they redid a bunch of that. I get my timelines a little
Yeah,
screwed.
the new clinic started when I started. So the new clinic was built in 2009. So when I first started fall of 2008, it was the old clinic right on the river, which then is now a nice little garden. And then this big facility opened.
Well, I feel like I've seen you all around town. I think it's the first time I've ever talked to any of you. And I really appreciate your time.
I appreciate you all being on. Thank you so much. And we will definitely want to talk to more ThedaCare physicians in the future. So I appreciate you all being on.